Hello, my name is Alejandra Arriaran. I am in California right now, and I've been in the United States for more than 20 years. Um, I'm a peer educator for American Bone Health, and I work educating women about osteoporosis all over the area. I am very passionate about it, and I think the Hispanic and Latino community need a lot of resources and a lot of support and education, especially women who are the the heart of their households and their communities. And yeah, it's a very different, it's a very interesting experience to get to know women from different parts of the world, even though we're all Hispanic or we speak the same language. That's not necessarily means we're all the same in every way. So I'm fascinated every time to get to meet a new woman from a different place and try to connect and communicate and see how different our own languages are. And they are strong and very dedicated, and they are survivors, I think, for the most part, when they come to this country and they work in different manual work and labor. They're very passionate what they do, and they want the best for their families, and they'll do anything they can to get to that. So unfortunately, it's really difficult for them to get access to healthcare, to get access to basic needs as far as healthcare goes. So they definitely end up going to emergency rooms and places like that when they just have to. There's no other way. So it's really important to get to them and bring them the message of preventive care, and to help them get the resources and the information they need to make better choices for themselves and their families. So the type of work that these women do are working in the fields here in this, in California. There's lots of strawberry picking and different types of farming here that's really needed. Packaging. There's also housekeeping type of jobs that they do. They are constantly working with their bodies. So, they are a much higher risk for osteoporosis in general. And all the labor and the physical work that they have to do, it's really hard on their bodies, obviously, and very hard on their backs. Now, most of them, I will say, like every single woman I've spoken to would complain about a back issue, shoulder issues, because of that constant repetitive type of movement. So their chances of having osteoporosis is much higher than white women. And then for Mexican Americans, it's even much higher. And so it's really important that they know and they can understand how important it is to take care of themselves and have a better way of doing things as far as flexing or picking up things and doing all that kind of physical work. So I've also learned that the way I speak Spanish is not exactly the same way that other women from Mexico, Dominican Republic, or Puerto Rico, or even Venezuela will speak. There's different ways of saying things. There are different words for the same thing, and so it's not simple, just a simple translation into things. So I would translate things for American Bone Health, or for the classes that I teach, where we're teaching people to squat or stand in a proper way. And we have the word hinge. You hinge from your hips, you hinge with your hips. And that word, it's really difficult to translate, because to begin with, it's not a verb in Spanish. And second of all, the way I would say it makes absolutely no sense to somebody else who is from another country, for let's say from Mexico, for example. So it's really depends on where you are, and even within the same community or the same country, words are used differently. And so it's fascinating how language could be so diverse within the same group of people with the same language. And that is very interesting, very important to be able to reach different communities, to know your community, to know where the person or patient is from, and the different ways the different places that they come within the same community is very, very important. Another thing I learned as well as working with women is that they are very resourceful. They will go and find ways to make things work in this country, even if they don't speak the language. They will try their best to try everything they can to get what they think is best for their families as far as healthcare, food access, daycare, all those things. And I've learned that they can tell. They don't even need to have somebody speak the same language with them or speak their own language that to feel that this person cares for them and they really are genuine and want to help. There's always this word that they say, I just came to my mind when I will be talking about somebody who doesn't speak the language and they're like working for them, for example. And they'll say, that person, they won't say, oh, he's a nice boss or he's a nice, lady. They'll say, no, they have a good heart. And that's the way they will describe somebody who they know they can trust, even though there's a language barrier there. So I think it's really important for physicians to know that they will feel that somebody cares and that they want to help, even though they don't have the language, even though they don't have sheets translated perfectly into Spanish or the way they speak. They can feel that, and they will be loyal. They will know, and they will stay, and they will come back every time if they felt that somebody cared and could help them. And they will go into their communities and they will spread the word and say, this person can help you, and they will be there, and they will be loyal, and their communities will benefit from that as well, besides their families, because it's a network of communities. So one of the things that I found it's very effective with working with women with osteoporosis or young moms, and with all interested in knowing more about their health and how they can get better with healthy bones, is to talk about how they can do things already implement things in their lives. So, for example, I will work with talking about functional exercises, or talking about just to sit to stand or squat, or when every time you sit in a chair, you're squatting. And if you do that in a better way than that you're usually doing it, your back is going to feel better. You're going to feel better. I don't want you to just do squats up and down 10 times every day for, I don't know, twice a day. It makes no sense. You want to have the patients or the people you're working with to feel that they can do something already with what they already do in their daily lives. So that's one. Functional is the things that they can do every time they get up. How do you do it? Every time you think about how you're doing it. We talk about nutrition just a little bit, but we do say, it's important to add more vegetables than starches or other things that are not as nutritious as what you're already serving. So instead of like maybe half or quarter of this, and then the rest could be more vegetables. So things that they can immediately implement in their lives, and say it's really not that you don't have to change everything you do. What you're doing is great. You're doing the best you can, but this is a better way that you can do something and either feel better, get stronger with your bones, to get your kids to eat better and have a healthier life. So all those things are have been very successful with working with them and showing them that they already doing it, that they are getting up and they're working hard and are doing those things, and they can, you know, be better at what they do, and prevent a lot of things with just small changes on their daily lives.